Good afternoon, Mike Jones, Fire Chief, City of Fredericksburg, here to bring you another update from City Council chambers about what the city is doing and how you can help limit the spread and limit the exposure to the COVID-19 virus. We usually always start off talking about statistics, and I'll bring up a few today. Most of the statistics will be in our written documentation that will be available on our social media platforms. But we do want to bring up the local statistics, and that is we've exceeded 100 cases in the planning district, which are the 4 counties in the city of Fredericksburg. We're now up to 108 total cases. The city now has 10 positive cases. Only one of those is currently in the hospital. The other 9 are quarantining at home. There are still only 2 deaths in the planning district, both in Spotsylvania County. The city government offices are still closed to the public, but we are still operating at full speed. Some of our people are working from home and other people are working in the office, but we're here to handle all your needs, whatever you need to work with city government to do, whether it be a building permit or paying a bill or anything like that. We're available and here to you to be able to do that. Electronic means work best if you can do that. Been a lot of talk out there about face coverings and face masks over the last week or a couple of days anyway. So let's talk a little bit about that. What is a face covering and what is it designed to do? Well, a face covering can be any type of cloth used to cover the mouth and nose of the individual. They can be bandanas, they can be scarves, they can be homemade. You can find a lot of that information on how to make a homemade cloth face covering on YouTube or any other internet platform as far as that goes. A lot of times they have some type of elastic or rubber bands that hold them in place. It only really needs to cover the mouth and the nose. It doesn't need to cover your entire face or anything like that, just enough to cover the openings for the nostrils and the mouth itself. So that's a good thing. The other thing it's designed to do is not necessarily prevent you from getting COVID-19, but prevent you from possibly spreading it if you're asymptomatic. So that's why a lot of times the CDC now has voluntarily recommended that you wear a face covering if you're going to go out, maybe to the grocery store or the pharmacy or some places in the open areas where you can't practice social distancing and things like that. And really what it's designed to do is prevent those droplets coming out of your mouth and nose when you either cough or sneeze or even when you're talking. Those little small droplets can come out. So it's designed to prevent those from getting out into the atmosphere and getting around other people and potentially causing problems with them. Again, we can't emphasize enough, you can use this face covering along with good social distancing to try to limit the spread of the virus itself. And the other thing that it does is it teaches you a very important lesson that we've talked about many times before, and that's not to touch your face, your mouth, your eyes, or anything like that, because that is how the virus gets into the body. It has to have an opening to get into the body, and it can use the eyes, or it can use the nose, or it can use the mouth. So that helps as well. What are face masks, and who needs them? Well, there are several types of face masks out there. The first one is a surgical style face mask. That's usually used by healthcare workers, doctors, dentists, nurses, first responders. And a lot of times they use that when they're examining patients who either they suspect of having a communicable disease, which is a contagious disease, or COVID-19, or even most of the time you'll see them when they're doing surgeries and things like that. The first responders use them in the same fashion to try to prevent problems there. They're designed to block large droplets. They can't do the smallest droplets like COVID-19 can put out when it's aerosolized, but they're designed to prevent those contaminants and those large droplets. They're also more form-fitting to your face. You'll oftentimes see them with a little nose piece right up here that actually allows you to clip it to the bridge of the nose, and they go around the mouth and the skull, and they usually have a headband or something that goes around the ears and protects it that way. But they're usually used by healthcare workers and first responders, not necessarily the general public. Our desire during this pandemic is to be able to take a surgical mask, and when we assess a patient, be able to have them put a surgical mask on themselves and then surgical masks on the actual providers. And that prevents the transmission of disease back and forth between the two, or at least knocks that potential down. So it provides protection both ways, to the patient and to the first responders as well. And then the question is, what is an N95 mask? An N95 mask is a particulate type mask. It's designed to filter out the smallest particles that can come out there, those tiniest particles down to so many microns. And it's usually used by first responders when they're dealing with suspected patients with COVID-19 or other highly communicable diseases. It's designed, again, to prevent those mini droplets from getting in. It knocks out over the 95% of those particular contaminants. They should not be needed by the average citizen. So just if going out to the store or something like that, you don't need an N95 mask. If you end up being a caregiver for a known COVID-19 patient, then I would talk to my primary care physician or the local health department about what type of face covering or face mask you might need if you go into the area where that person is isolating, if they have to be taken care of or something like that, or you have to bring something to them. But other than that, N95 masks and surgical masks, the average citizen shouldn't need if they're just going out in public. Just a simple face covering will work fine. And again, there are a lot of places, I just did a little research earlier, you can go on the internet, there's a lot of places that tell you how to make them and the different materials that you can use and things like that. So take advantage of that and check that out if you're going to use a face covering.